Why? Why did the WHO on January 28, 2020, 8 days after the first case entered the United States, say more data was needed to declare the COVID-19 virus a public health emergency? Why did the WHO say on February 3, 2020 that travel restrictions were unnecessary? Why did the WHO say on February 29, 2020 that airport temperature screenings alone were not effective and not worth the expense? Why did it take 21 days for the CDC to provide a working PCR test for the public? Why did the initial test kits shipped to certified labs give sterile water a positive result? Why did the CDC have such narrow testing protocols if asymptomatic spread was such a concern? Why did the hospital ships Mercy and Comfort stay almost totally empty? Why was the Javits Center closed in May 2020 after treating 1,000 patients? Why were the field hospitals in Central Park closed? Instead of using the above facilities, why did those recovering from COVID-19 go to nursing facilities? Why were people silenced whose symptoms immediately improved with hydroxychloroquine? Why have some people had no symptoms? Why have some people had mild symptoms? Why have some people had severe symptoms? Why have some people spent months in the hospital? Why did all the first studies on hydroxychloroquine involve people who were critical? Why were the hydroxychloroquine studies showing improvement with early use not peer-reviewed and disseminated? Why was hydroxychloroquine banned in several states? Why was a pulmonary specialist's testimony before Congress removed from YouTube after he said ivermectin must begin immediate use or hundreds of thousands more would die? Why did every study pointing to life-saving therapies get buried by a newsprint avalanche? Why are people still dying of COVID? Why are people still dying of COVID? Why are people still dying of COVID? No one should be dying of COVID. Since we're all being told to mask up again, we need bigger guns. What we need is success. Why has success been shot in the head?